Hi there, thanks for tuning in, and welcome back to Health Bunker Lyme podcast. And today we're going to be talking to Health Bunker Clinic's Aaron Carnahan. Now, Aaron's got vast experience, in fact, well over 25 years experience in nursing in different situations. And he's also our clinical manager at Health Bunker, in charge of training the other nurses, and he's become an expert on ozone therapy and the treatments as well. And that's what we'll be talking about today in this interview. This podcast will be available on Spreaker, Apple Podcasts, Spotify, iHeartRadio, Google Podcasts, Castbox, Deezer, Podcast Addict, Podchaser, and many more. I'll also upload it to YouTube with a film behind it. So sit back and enjoy this interview. Thanks for tuning in. So right, here we are for podcast number 3 on Health Bunker Lyme podcasts. And today we're going to talk to I suppose he's more or less medical director of Health Bunker Clinics, Aaron Carnahan. I've probably destroyed that name again, but he's only just told me how to pronounce it. I've only known him a year anyway. Well, that's perfect.
That's pitch perfect.
Thank you. I don't know about pitch perfect, but anyway. We're going to jump straight in, really, and go into some questions about Aaron's background in New Zealand, where he grew up. And so I suppose that's the first question. Where did you grow up, Aaron?
I grew up in a small town called Nelson at the top of the South Island and came over to the UK in 98. But I did my nurse training over there. I worked for a couple of years and then came over and worked pretty much exclusively in the NHS since 1998.
So where did you work when you first came over then?
I was working in and out of hospitals in London. Some were NHS, some were big private hospitals, but that was back in the day when there was a lot of easy jobs going where you could just pick up a phone and say, can I work tonight? And yep, no worries, you get a job. The stipulation was that I could work for half of the time that I was here, and it was a working holiday visa, and that's what I did. I worked and holidayed for 2 years and then just carried on just working and eventually got indefinite leave to remain in the UK.
Right, so going back out, when did you pass your nursing qualifications then back in New Zealand, did you say?
That was back in 1994.
We're showing his age now there.
Yeah.
Whereabouts did you train in New Zealand?
I trained where I grew up. There was a nursing school in Nelson, so I was there. Then after I'd qualified, I moved up and worked in Auckland. That's not the capital, but that's just the biggest city. I'd worked there for perhaps about 3 years before I decided to come over to the UK and dip my toes in, and I'm still here.
So why did you want to get into nursing? Was it nursing or health you wanted to get into? What was the idea behind it?
It was primarily health. What I was always interested in was improving health. I'd always see a lot of people and they'd be poorly. And I thought that there must be ways that they can not just get better, but do things that are proactive to enhance their own health. And that's an area that I particularly enjoyed working in. And I've worked in and out of those areas, but that's always been a strong focus on the work that I do.
So did you think that from quite a young age then, that kind of helping people?
I think I did because we had quite an active lifestyle. New Zealand just is largely dominated by its outdoor activities and the things that you do. So naturally, if you can't do those things, then you're missing out on an awful lot.
Yeah, and so why the jump to the UK?
That was a mate of mine who said, do you want to come to the UK, Aaron? And I said, yeah, all right. And we did. We just jumped on a plane and away we went. If you're under 24 with no criminal convictions and some money to support yourself, because we're part of the Commonwealth, you can come over for a set period of 2 years. But because of the essential work that I did, I was always sponsored by my NHS employer to stay on a rolling 2-year basis. And then once you'd been here for 10 years and kept your nose clean, you could apply for what they call an indefinite leave to remain, which is what I have. So I still have a New Zealand passport because, well, I guess now with Brexit, it's a bloody handy thing to have. I don't need a UK passport.
Yeah, too right. Yeah. So when did you're now a practitioner nurse, and what is the terminology for what that qualification is?
It's a nurse that's done a number of years of experience as well as additional qualifications. That's the current role that I have, and it's like a protected title. You can't just call yourself a nurse practitioner unless you're actually employed as one. And one of the things that you have to be able to do is physical assessments, treatments, which involves prescribing. So, of course, if someone comes and sees me, it's not too dissimilar to going and seeing a junior doctor or a GP, where they can diagnose an ailment and also provide treatment for it as well. So, I've got a broad formulary, which is the same as what GPs can prescribe to make people better. But I try and stick to a limited kind of formulary within my own field of experience, because you know, anytime that you're working in an area where there's the potential to do someone harm, there is risk. And with risk comes litigation. So it's always best to try and avoid those kind of situations and just stick to your strengths.
Yeah, it makes perfect sense. And what are those strengths? What sort of background in nursing did you? I know there's obviously lots of different variants of nursing. Which one did
Yeah.
you choose and specialise in?
Well, I'm dual qualified, so I can work in mental health or I can work as a general nurse, which general means basically from the well, not mental health, everything else, and that's the area that I've specialised in, and it's been adults rather than children, pediatric, and presently I'm working in a number of different areas, and I'm kind of known as the blood guy, really. I do an awful lot of work with needles. I take blood, I analyze the results that come back. I do a specialist project for the NHS where I work exclusively working with men and some women who use image and performance enhancing drugs, anabolic steroids, for example. That's a particular area of interest to me. So I've covered a lot, and in my work as well, I work part-time in a prison, and I'm a generalist specialist there. So I see everything from nasty traumas to long-term conditions and the way in managing those, which can be things like cardiovascular disease, diabetes, asthma, all those things that sort of bother the modern population.
Yeah, you don't just have to be in prison to suffer from those, do you?
No, that's right. Yeah.
Right then, I think we covered quite a lot of background there, and I just wanted to build up a picture of what your training was, what you're currently doing, before we jump into what we do at Elf Bunker. And
Yeah, brilliant.
I suppose now we'll come back to that. When I first spoke to you about 12 months ago, did you actually think, what's this crazy lunatic from Yorkshire on about putting ozone, mixing it with blood, and then replacing it back into someone? Did you actually think,
I was,
what did you
I
actually
was,
think?
I was thoroughly intrigued, and we were introduced by a mutual friend, and he said that there's a chap that you might be interested in talking to, because he's got Lyme disease and he's considered something of an expert in his field, and he does this thing called ozone therapy, and he's looking for someone that can basically pick up where somebody else who had been traveling back and forth from London, pick up from there, because they're looking for someone with particular skills, which I ticked all of the boxes. So I gave you a call there, Dom, and we had quite a long conversation, and then decided to meet up. So I made the trek up to Halifax, where the clinic now is, and I just thought, do you know what, this sounds really interesting. But at the time, it was really quite difficult to try and find anything about ozone. You'd look at on the internet, or you would speak to people and they'd raise their eyebrows and had never heard of it before. And a lot of the information then was anecdotal. They were basically just stories that people had told, and they were generally success stories. But the plural of anecdote does not mean study or research. So between us, we did a lot of information, and you were brilliant at being able to signpost me in the right direction to find the right sort of information that I needed. Things have changed considerably now in the last year. Now there's a plethora of actual proper valid research, and really we've got our friend coronavirus to thank for that.
Yeah, I mean, there is a lot of research that will probably come to that at some point.
Yeah,
But
yeah.
for anybody who's listening, who doesn't know what ozone is, do you want to give them a brief explanation from your point of view? I mean, I rattle on about it all the time, but obviously my explanation, I prefer to read it from somebody who's more qualified than me, if you like, from an academic point of view.
Yeah, yeah. I like to try and keep my explanations as simple as possible, but
Yeah,
no simpler. Um, Ozone is effectively three oxygen molecules which are stuck together, so it's O3 rather than O2, the usual stuff that you expect in the atmosphere. And when oxygen is electrically charged, it creates O3, but it's thermodynamically very unstable and will quickly revert back into just a spare oxygen again. Um, and ozone has some really quite remarkable properties that can only be harnessed in such a way that the correct machinery, technique, application to get its optimum therapeutic benefits can do. And there's a lot of them. It does so many different things which help so many different conditions. And what I really liked about it was the safety. It's just so safe. People always worry about, when you get an injection of something, for example, everyone's flapping about little bubbles of air that might go into their veins and cause them to be dead. It doesn't work like that. So when we're thinking about putting blood and mixing it with a gas, you can't help but think, oh, there's some attendant risk there, and there simply isn't, because the technique is so sophisticated that I think the closest thing that you can liken it to would be hemodialysis, where blood is drawn out of the body, stuff is done to it, it's put back into the body, and it's better, and it makes the body work better.
yeah, and I suppose, all right, you're mixing it with ozone, but it's already got oxygen in it anyway, hasn't it? So it's already at some point it's had gas put in it.
It has that, and that's our lungs that have done that. But where we're taking the blood from, we're taking it from the veins, and that blood is blood that's making its way back up to the lungs to get more oxygen added to it, to the heart, then back into the circulatory system. So effectively, it's deoxygenated blood,
Yeah.
and we're giving the lungs a real helping hand here by adding the oxygen to it before it even gets to the lungs.
Yeah, I mean, obviously you can't breathe ozone. That's one of the things that you can't do. I can't stipulate that anymore to people, but um, reoxygenating has to have benefits. And from a personal experience, I know it has benefits. My wife does, and all the people that come to the clinic seem to say the same thing as well. That's another thing we'll come to later. That's an interesting part of the process, is watching other people and have the treatments.
Yeah, for sure.
I mean, you don't just talk the talk, you walk the walk, and you've had probably every treatment from an ozone perspective nearly now. And you've had ozonated water, you've had ozone injections, and you've obviously now having ozone IVs as well.
Yes.
And so I suppose one of the good ones to start with would be, you had an ankle injury and
Yeah.
you had a few ozone injections directly into that region. And so how did it make you feel, or how did it make the ankle feel on the days after that?
Well, it helped. It helped a lot. It felt much better, faster. I'm going to regret saying this, but I'd almost wish I'd actually injured both ankles so I could only treat one, so I'd have the other to compare it to.
Yeah.
It did do some good. It was an acute injury. It's what they call a pronation injury, where you land heavily on your foot and you turn over on the outside of your ankle. And it was a sprain, so it was quite nasty. A sprain is where there's damage to the ligament, which links the bones to the bones, rather than a sprain. So there was an extensive amount of swelling and bruising. And I would say probably about 15 to 18 mils of ozone at a concentration of 25 micrograms per mil was injected directly into the injured area. And I was running again a week later. I didn't expect that.
No, I don't think many people do when they have that type of treatment. How quick
Yeah.
it works. And it's quite freaky, really, because like you've just said, you wish you had two injured ankles to play one against the other, because you could carry an injury like that for months or years, and then have a treatment. It goes, and you think, well, I wonder if it had just gone anyway that week. That's how
That's it.
subtle it is.
You're right, because conventional wisdom says that you should anticipate a healing period of between 4 to 8 weeks, usually around 6, we say. But this was 2. So we're talking about a significant decrease in the amount of time it took to get well again. And the way in which it worked was absolutely fascinating, because what people tend to do is they have an injury such as that, and they neck lots of anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs is the family of the name, and they include things like aspirin, diclofenac, naproxen, ibuprofen. That's a popular one, but that's counterproductive. And even modern medicine is moving away now to just going back to the rest, ice, compression, elevation, and avoiding the anti-inflammatory drugs, because they inhibit something that our body needs, which are they're a substance called prostaglandins, and they're basically mediators in the process of inflammation, and the anti-inflammatory drugs block the production of these. But you need them, because if you think about an injury that you have, it becomes painful and swollen and reddened and tender. You don't want to put any weight on it, and that's your body way of saying, all right, just give it a rest. Fair enough. But what you don't want to do is impede the signals from the injured area to the brain, and not have them send the good stuff that's required to enhance that healing of the injury. And that's precisely what ozone does, is that it works by mediating the responses from your body that says, this area is injured, let's get some help there quick. And that's kind of exactly what happened with my ankle.
Yeah, it's every time I either have the treatment myself or I see someone having it and get the response like that, it always, I've still got an element of shock, because we've all brought up in the take a pill and it goes away type of scenario. And I ain't saying there isn't a place for that, because there's always a place for that as well. Somebody's in severe pain and they need to get through a day for some reason or whatever, because they're injured, then you need to give them something that's going to help them. The long-term stuff just doesn't seem to work like it should do. And what ozone does, it cuts down the time where you're going to be laid up, and also enables the injury to heal quicker. That's what it's done for me anyway.
It does, because there is an increasing reliance on people thinking that there is a pill for every ill, and with every pill there is a side effect. And with certain strong painkillers like opiates, for example, there's a risk of dependency as well.
Yeah, there is. I mean, there's many different modalities with ozone, and we'll talk about a few today. But you've had the IV, or a hyperbaric ozone, as we call it. But there's so many different names to it. It sort of confuses people. There's so many ways that people take blood out. That some people take blood out and put it in a bag, and they ozonate it over a period of time, then put it in. There's ozonated saline that can go. I know we're going to have a look at ozonated saline, because it seems like a really interesting treatment as well. But you've had the passes, the IV passes, and if you can just explain what the process is for that, not necessarily what it does or anything, just more the process from start to finish, and what the sort of things we use, anticoagulants and stuff like that in that process.
I think the best place to start as well, particularly for people who are thinking about going down this route, is what can you do to help yourself to make the process more efficient and effective. You need to make sure that you're well hydrated, because a lot of our body is just fluids. So if you're poorly hydrated, then your venous access, the ability to be able to access a vein, is lessened. So I was well hydrated. My veins were good and balanced. The room was nice and warm, and a phlebotomist, someone who is specialized and trained in working with veins, was able to insert a cannula, which is basically just a Teflon plastic bendy tube, into my arm, but it requires a needle to insert it. So there's a sensation of a sharp scratch, but that's all. And then that is fixed down with a proper plaster, and then I'm hooked up to the machine, and it's really quite cool because all I need to do is actually just sit there, and obviously I was having to give the instructions of what buttons to press and how to do it. But you watch the blood come out of the tube, and the machine is very, very clever because it's what they call hyperbaric. So it does something where it creates a negative pressure, so suck, so blood comes out, and then positive pressure is added in when the ozone gas is infused back into what's called an iset, which is effectively like a 200 ml egg-shaped container, which holds the blood and agitated gently and then goes back in. But when blood is taken out of the body, it has a habit of wanting to just go sticky and turn into a clot. We've all seen blood spilt somewhere, and it just turns up in a crusty mess. So we don't want that to happen when the blood is outside of the body. So there's two options that we have. And one is to use a substance called sodium citrate, which is excellent. It does come with a side effect of having a taste, because as I mentioned before, when blood is going back into the body in a vein, the first place it hits is the lungs. So you're going to be breathing the stuff out. You can taste it. It's not an unpleasant taste. It's just something that people need to be aware of. Or there's heparin, which is a anticoagulant drug, again, just to stop the blood from turning into a scab, a mess when you take it out of the body, and it gently goes back in. There's very few people that have difficulty with heparin, and it's something that we probably need to talk about as well, because if someone is already on some kind of anticoagulant drug like warfarin, for example, or if they're taking industrial quantities of ibuprofen, they might not be able to have it, or if they've had an allergy to it in the past, perhaps if they've woken up with weird or wonderful bruises and don't remember knocking into themselves and gone to the doctor and realize they've got a clotting disorder, heparin's not for them. But there's other ways around that we can use the sodium citrate. We can use that for a number of passes. I quite liked the process. It didn't take long. And afterwards, I felt not a great deal of difference. I wasn't quite sure what to expect. But it wasn't until I gotten home after a 2.5 hour drive and got out of my car, and the usual aches and pains and frustrations of being in a car were absent. They were just not there. Sometimes it's the things that you're used to that you get used to, and when they're not there, that's when you really appreciate, right, this has caused a change. This is good. This is really quite something. Slept very well that night, woke up the next morning and did not rip the arse out of my snooze button as I sometimes do. Just alarm went off, bang, out of bed, away I go. No drama. So it's a lot of those little things made a big, big difference.
Yeah, I mean, that's really, in a nutshell, how you just explained the treatment and after the event of the treatment is how I felt. I mean, I never, because with Lyme disease, you never get the sort of buzz we see some clients get. They get a real impetus of energy after a treatment, some people. We never get that. It just brings you up to a level, really. But what you get is, on the days and weeks afterwards, it's still working inside you because you've still got a little bit more energy. You're a little bit brighter. You just can't explain it. It's not like taking a prescribed drug, for argument's sake. You don't feel that rush or alcohol or anything like that. It's subtle. It's very subtle. And well, that's how we've explained it, and that's how we feel every time after having a treatment. And what type of issues have you seen this particular treatment help over the last 12 months?
Numerous now, actually. We've done rather a lot of treatments. I've seen the most spectacular changes in people that suffer with chronic fatigue issues. They come in and they don't have a great deal of energy, and then they leave. And immediately after a treatment, one of the things that you notice is more of a luster in someone's eyes. Their eyes look a lot brighter. They're also a lot more talkative. I mean, obviously people are going to be a little bit anxious coming in, and sometimes people gabble when they're anxious, or sometimes they clam up. But everybody who has a treatment ends up being really quite talkative and feeling it's euphoric is not the word for it. It's more of a feeling of, do you know what? I actually genuinely feel better and healthier and happier.
Yeah. What's the biggest eye-opening moment that you've sort of witnessed from a client after having an ozone IV hyperbaric treatment?
Yeah. Some have been, okay, it would be a lady who was reasonably young, who had chronic fatigue, and then the next we heard from her, she had taken out a gym membership.
Yeah, she had fibromyalgia, didn't she?
Fibromyalgia, my mistake. Yeah.
And she had chronic fatigue, fibromyalgia, and an illness where a joint dislocated, if I remember rightly.
That's right.
A spine. Yeah, and she rung me back and said she'd taken out a gym membership for first time in 2 years.
Yeah, I was astonished. That was remarkable.
Yeah, I think you texted me after that treatment and said, "I'm not one normally for emotions, but that were closest to tears I could have come." And same here. I were there. I witnessed it. It was quite an emotional time because you asked her, and I'm going to interview her. Actually, she wants to do an interview. But you asked her, out of 10, what was your pain when you walked in the door? And she said 10 plus. Yeah, and you said, what is it now? And this was 10 minutes after treatment.
Yeah,
and she said 5. And you could tell with her face, she just didn't shut up at all. And it were quite a spiritual moment for me. That were interesting. What's the biggest challenge to this treatment? You were talking about vascular qualities and stuff like that. Is that the biggest challenge, you think?
It is for me, yeah. Because everyone has different plumbing. Some people have got veins which are very prominent and they're very vascular, and it's very, very easy to perform the procedure that we call cannulation. Sometimes it's not that easy for people if they've got particularly weak veins, if they're not adequately hydrated. The cold never helps, of course, so people must ensure that they're warm in the car on their way there. We always keep the clinical room nice and warm as well. That makes a big difference. So if someone doesn't have veins which we are able to access, because what we must remember is that blood, it literally is thicker than water, and we need to be drawing this out of the cannula out into the eye set so that we can let ozone do its thing. And if that's not possible, then luckily we've got other options which work equally as well, in a different kind of a way, but they are very effective. So it's reassuring to know that if someone comes in and it's simply not possible to cannulate them for whatever reason, whether they've got vein damage, whether they're elderly and frail, that there are alternatives. But I would say the biggest challenge is initially just performing the cannulation. But being, the blood guy and having decades of experience, it's seldom an issue.
Yeah, it's very rare. But I mean, we can do a treatment, which, I mean, we'll probably do separate podcasts for individual treatments where we can drill down and go into a lot more detail. I think that would be a good idea.
Yeah.
But we do rectal insufflation, which that isn't, they say it's nearly as good as a 10-pass treatment, but it works in a slightly different way, doesn't it?
Yes, it
obviously.
does. Yep.
And that is a colonic type treatment where ozone is inserted into the colon or the intestines. It goes up the colon and eventually makes its way to the portal vein. Am I right there?
That's it. Yeah.
Yeah. Which then ends up in the liver. So it is a really good treatment. In fact, Marius, the chap from the Herman, the company that we use for the equipment, says it's 90% as good as having a ozone 10-pass. So somebody with who has bad veins always should opt for that sort of treatment rather than a 10-pass treatment.
Yeah, and we can always look. We've got there's different things that we can use, and given the past experience that I've got with working with blood and working with veins, and I've been able to bring this into the ozone arena as well, is that I do prefer to use a cannula, which is essentially just the same as what you'd have if you had a drip going into your arm. But we do also have a butterfly needle, which is a fixed needle, slightly smaller gauge, a bit shorter, but I'm not so much of a fan of them. But they are certainly an option, and we can talk through with people what the best way forward is for them to get the best benefit.
Yeah, and we've we've come a long way in the past year, even though during the current situation seems to be sort of dragging us back a little bit. We're learning new things. I mean, ozone injections are another new one, really, for us to do. And I've been the sort of test dummy, if you like, to
Yeah.
on all these treatments over the last 12 months when we learn something new. And I've had half a dozen now. Ozone. I'm going to have some more tomorrow. Ozone injections,
Yeah.
and the range of movement from a lateral raise point of view.
Mm-hmm.
There's no pain there now from my shoulders and my neck. Absolutely none. I used to get loads of clicking. It were like somebody playing a xylophone every time I did any form of training on my shoulders. And I get one small click now in my left shoulder. And that's from 6 treatments. That's amazing, really, for me, because chronic pain with Lyme disease is the residual evil, if you like, that you're carrying around with you.
Yeah.
And I think that's probably from where your next is, where we're going to move into now, is sports injuries type of world as well. Because
Yeah.
that's where that takes you, isn't it? So, yeah. What would you say sums up Health Bunker Clinic? What do you think we stand for?
I think it's basic. I think it's openness and honesty as well, because there's been other people that have gone to other clinics and they've said things that have alarmed me, and a classic, the best example I can think of is a gentleman asked me, how much am I getting? How much ozone am I getting? And I said, well, we've got the concentration at 35. And he said, well, I went to a clinic in London and they just did one pass, and it was 1700. What's going on there? So we did some basic maths and asked how much blood they drew out for the pass, and it was 50 mils. So if you times 35 times 50, that's your 1700 right there. So that's I think a bit of a cheeky marketing ploy that other people can use. So we tell people we're going to draw out this much blood, we're going to be using this concentration because that's the most effective for you. We're not going to say, oh, you need 10 passes because 10 passes is better than 2, because it might not necessarily be the case. In fact, sometimes I think it's better to begin conservatively so you don't end up with a reaction that you don't want to. Because if you've got a number of different ailments trickling around your body, whether it's toxins, parasites, autoimmune issues, regardless, ozone is going to be making some changes, and some of those changes can be dramatic and profound, and that can cause the body to go and have a bit of a reaction. They often refer to it as a Herx reaction, where people actually feel worse than what they did before they started, and we never want that. We want people to get better as quickly as possible. And another thing as well is, I was asked, why is the blood not turned that sort of really pink color, like it's full of oxygen? And it transpires that I was using heparin because that was the most appropriate treatment for this gentleman at the time, because we were doing 10 passes. And it turns out that sodium citrate, when used as an anticoagulant, causes the blood to change color. It changes into a pinkish color when it's actually in the eye set. So that is just more showmanship. So people can manipulate statistics to say, oh, you're getting 1700 when really you're not, and your blood's turned pink. You may as well say, well, your farmed salmon's pink because it's better than organic salmon, whatever. So we work well in the Health Bunker by sharing information, not just with our patients and our clients, but also with other practitioners. We've developed a really good network. It's almost like we're the kind of people that amalgamate the UK to ensure that ozone therapy is delivered in the best way and in the safest way as well. I really like that.
Yeah, I mean, for you, it must give you a different view as well, coming from the sort of background that you have. there's one side of health, and then you'd experience a new side of health as well. And bear in mind that we're still using a prescription drug to stop the blood from clotting. So we're mixing both types of medicines, really, aren't we? As well.
Oh yeah, everything has to be up to the highest possible standards whatsoever. And at the moment, that includes things like personal protective equipment, making sure that we've got the correct equipment in case that there is some kind of medical emergency, because someone might come in and they might have an issue, and it could be that they're diabetic or something like this. So we need to be able to, when we're not a beauty salon, we're a proper clinic with the correct equipment to ensure that the care and the quality of care is given to the highest standard that you can get.
Yeah, well, we want that private clinic feel, don't we? That's what we're going for, really. It's that high standard clinic that we want.
There's absolutely going to be no shortcuts taken, and it's taken us a long time to get to where we are, and we're not going to be rushing anything. We're going to be doing everything properly, working with our colleagues and other people who do this as well, to ensure that not only are we giving the best service, but helping them to give the best service as well. We're developing excellent networks just to ensure that this treatment that we're giving, not only does it work, but it's also credible. It has to be credible.
I had a friend who went to a really good clinic in Cyprus. I won't mention the name. And talking about strength of ozone, he had chronic Lyme disease like me and Nick did have, and he was in a bad way when he went. He saved a fortune up to go. First treatment, 10 pass, bang, 70 gamma of ozone, okay. Double what we were just talking about. Yeah. After 2 passes, felt really ill, and they said, no, that's how he should feel. Carried on the treatment, and he couldn't have any more treatments, and he was there for 2 weeks. And that just sums up what you were talking about before. I just remembered that, where more isn't always better. Sometimes less is best.
Yeah, it is. And like every kind of niche market as well, it has its own sort of vernacular, its slang. You were talking just now about gamma, and people need to know what that is. And it effectively just means microgram, which is a thousandth of a gram, and it comes from the Latin abbreviation of UG, which kind of means the gamma. So gamma is a microgram.
Yeah, and obviously, what's going on at the moment? We've got really good information coming out of Italy, haven't we? And Germany,
and Spain, and Iran, and you name it.
Yeah. I mean, there's a lot of treatments going down with the current crisis. Regardless of anybody's views, it's certainly helping people. There's no doubt about that.
Yeah. People are becoming unwell. It's what they call a novel virus, because it's new. So there's a lot of speculation about what is it, where did it come from, what does it do, how does it work, and some of the answers are we don't know. And there's mutations that are evolving as well. But what we do know about ozone in relation to viruses is that they destroy viruses. There's a wealth of evidence how well it works for things like the herpes simplex, HIV, hepatitis C, those kind of things. Because what it does is it stops the viral replication. It destroys them, and it also helps what they call immunomodulation and oxidative stress regulation. But they're just big words that basically mean that it helps your immune system, and it also helps to kill off the viruses as well. Ozone has got a very, very strong track record of that, and there is an emerging body of evidence now that's saying that it's going to be an excellent complementary therapy that will help with COVID-19 as well, particularly when we look at things like long COVID, which is something that is developing. It's new. No one knows all there is to know about that, other than the fact that it's something that exists.
Yeah, so, I mean, we're coming to the end now. Can you believe we've been on for nearly 40 minutes? Aaron? Aaron's a man of very few words, and he was, I wouldn't say we're panicking, but he didn't know how long he could chat for, and we've just done 40 minutes in a breath there. So, I mean, we've got some quite big plans for this year, depending on obviously how things are thrown at us. But we've now got 4 people that are accredited, 4 nurses accredited to use the equipment. They've just got to go through Aaron's strict training practices, if you like, which could take us a month or so to get that up to speed as well. And we should be fully operational with multiple people being able to do these treatments. Quite exciting, is that, to be fair. So, I mean, we can do ozone hyperbaric treatments, ozone injections, ozone insufflations, which is both rectal and vaginal, which we had some fantastic results from herpes simplex treatments and other STDs and thrush and things like that. So, but what are your goals from an ozone perspective this year? And it's quite a broad question, that, but
it is
for the last question.
I think it's going to be a matter of consolidation. It's exactly as you say, is to ensure that the staff that are working for the health bunker are working to the highest possible standards, and delivering the best and most efficacious form of ozone therapy to the right people who need it. So it can be anyone that is applicable, but it would depend on what their needs are as well, because if someone has a long-term chronic autoimmune disorder, that differs somewhat from someone that's looking to do it from a health promotion point of view, a wellness type of thing. And everyone's going to have their own strengths, and I'm a firm advocate in not necessarily identifying an individual's weakness and trying to bring that up, but right, what are you really, really good at? Let's focus on that. And that's what the health bunker is going to be. It's going to be somewhere that you'll go where you'll see the right person who has the right amount of knowledge and experience to deliver the treatment that you need.
And I suppose I want us to be a one-trick pony where we're experts in ozone, because there's not many clinics that are in Britain, and I'm not denouncing anybody there, but a lot of people do a lot of things in clinics. We are just doing ozone at this minute in time. We've got plans for other things, but at the moment we want to get to be where everybody's trained up to a certain standard, don't we, on ozone?
Yep.
Because of the difference we've seen it make. Right, well, we've come to the end. So I'd like to thank Aaron for joining us, and we're going to do some more of these, but we'll probably drill down into some probably anecdotal stuff where we've had a few people in for treatments of certain things where we can give some sort of results without naming names, obviously. And also we'll drill down into specific treatments and go into strengths of ozone and things like that as well.
Yeah, that's a good idea. Yeah, you're welcome, because case studies are always worthwhile. They're always relevant, and I'm quite happy to answer any questions that people have as well. Perhaps if they fire them your way, and I can do my best to explain them, because it's complex, and you need to be able to explain it in a way that people can understand rather than just use big words.
Yeah. Right. Thanks very much.
Brilliant. Okay, Dom. Thanks very much. I'll see you again soon.
Thanks for tuning into this Health Bunker Lyme podcast. I'm your host, Don Waterson. Remember, it's your life, own it. See you next time.